Up in the hospital can be scary. You're sick and you have no idea what it's going to cost to get better. The federal government wants to make things easier by requiring hospitals to list prices online. 2 weeks into this new law, Channel 2 Investigates is checking to see what those lists look like and how easy they are to navigate. Investigator Bill Spencer found that even healthcare experts had a tough time figuring it all out. And tonight he's revealing the roadblocks and 2 websites that could help you compare prices.
At the exquisite barbershop in Humble, Christopher Hawkins and Mike Moffat cut hair for a living. But what they'd really like to cut are their healthcare costs.
Hospital prices are ridiculous high.
You see, Chris and his wife have 4 kids, including 9-year-old Christian, who has autism and requires lots of hospital time. When you take your son Christian in for, say, an MRI, do you have any idea what you're going to pay?
No, sir. Not at all.
Mike shares the same frustration. Both he and his wife, Andrea, are diabetic, spend a ton on hospital visits, and wonder why they can't simply price shop when it comes to hospitals.
Where you go to a supermarket, you know, you buy some ham or some bacon, price points listed. You know, or you go to a car wash, you get your shoes shined, price points listed. So, you know, I can understand why hospitals wouldn't list their prices.
Now, all of that is changing. As of January 1st, a federal mandate went into effect, requiring all this nation's hospitals to list the prices they charge online for everything, including procedures, testing, prescription drugs, even medical supplies. So everyday folks like you and I can actually price shop for hospital care.
This is probably seen by the government as a first step. It's not a great first step as I see it for customers.
Why is that? To find out, Channel 2 Investigates sat down with 2 medical pricing experts, Vivian Ho, health economist at Rice University's Baker Institute, and Shawn Fry, president of Prevalent Health, which has analyzed pricing data for over 100 hospital systems.
I don't know what these things are.
And what we found were prices for procedures and services written so complexly, the average guy could never understand them.
I don't know what a nail LNG R1/5 11 XR 360 X125 is. Something called a kidney side del BN sub, which the charge is $67,360. An IR shuntogram is $680.
You're in the business, and do you understand these terms?
I have a hard time understanding exactly what any of these things are.
I'd like to find out what the price is for a colonoscopy at the hospital. Can you try to find that for me?
Yes, I will.
As for Shawn, we spent over an hour looking at 7 different hospital websites in Houston for the price of a colonoscopy. And we're only able to find it and understand it at one hospital system, Memorial Hermann.
It says $10,545.
Yes, sir.
Is that exactly what I'm going to pay?
No, sir. It's going to look on your deductible. It's going to look whether or not you're in network with this provider.
But even when you find the price, Shawn says it will vary depending on the type of health insurance you have, your deductible, your copay. A better idea, he says? Go to a hospital cost comparison website like healthcarebluebook.com or clearhealthcosts.com, where they list approximate costs for various procedures in your area. You should also call your insurance company, ask what your cost for the procedure will be, and finally, call the hospital and ask this question.
The key thing to ask, is this a global price? What's included in the global fees for this particular service?
Now, while both of our hospital cost experts say the bulk of these hospital price lists tend to be difficult to find and difficult to use, they say if you can actually find the price for the procedure that you need, it will at least give you a ballpark idea of which hospitals tend to be cheaper and which tend to be more expensive. If you go to our website, we provided links to 2 very good cost comparison websites, healthcarebluebook.com and clearhealthcosts.com. I'm Bill Spencer, KPRC, Channel 2 Investigates.